When we're dealing with patients with alcoholic problems, obviously we have to look at their dependency. We've got to look at the fact that there's an underlying problem towards their drinking. So what we do is we draw a care plan up, because obviously there has to be the support right the way through the programme. Obviously we've got to look at all the aspects of care emotionally. We've got to look at the holistic approach. We've got to look at the continuing support throughout that period. Obviously, binge drinkers, that can lead to alcoholism, because somebody doesn't have to be deemed an alcoholic by drinking every day of their lives. What we do have to look at is the fact that how much it can damage the body. Obviously, it can damage the liver, leading to cirrhosis. It can cause all types of problems with blood. We often find that cancer can be a problem that can be related to drink. So obviously there's the health issues aside from everything else. We try and continually support patients by obviously asking them to attend AA meetings. This then gives the continued support throughout our treatment programme. We have to realise that this is going to be ongoing, and obviously that there will be failures. Sometimes people will relapse, go back to the drink that they haven't known any other. We obviously have to set programmes in place to support every individual that comes in emotionally. We've got to provide the medical support, and it's ongoing throughout the whole programme. If there's a relapse, then obviously what we do is we will support that person in every way that we can, both medically, professionally and in a holistic approach. We will give counselling, support in AA meetings. We will obviously continually check health, check bloods, check all the necessary things that we have to do, put in place, so that that person hopefully could have 100% recovery before there is too much damage to the body. There are ways obviously that the family can be brought into this by supporting sisters, brothers, mothers, to be aware of the problem, for them to actually admit I have an alcoholic problem. This is because it could be a certain area, it could be bereavement, it could be the loss of a child, it could be all sorts of trauma, loss of a partner, all sorts of things can turn somebody to obviously having a dependency upon drink. We just say each time that if the support is there, we give the support. We can only try every avenue, obviously give the support, and just obviously point out the relevant medical problems that this would entail.